Now for this next question, students were asked to give reasons. Okay, so if you are trying to correct dehydration in children, one of the first things you do is to give what? Antishock. Antishock are also known as the initial volume expanders. Okay, so why will you give? So it's not all about talking about things. They expect students to know reasons why they actually do some particular medications and all of that. So for anti-shock, what we have, reasons why you give anti-shock to correct, first of all, okay, so when the child is dehydrated, that's hypovolemic shock. If you are trying to expand the volume, is very important. Okay, so the volume expanders we are talking about here is things like Ringer's lactate and also your normal saline. So they are actually quite important. Okay, they are quite important. So what are the reasons? First of all, you want to improve tissue perfusion and oxygen delivery. Okay, so shock causes inadequate blood flow to vital organs like brain, heart, and kidneys. So initial fluid boluses will now restore this perfusion, and to prevent those tissues from actually becoming what? Ischemic. So correcting hypotension and weak pulse. So children in shock present with rapid weak pulse and prolonged capillary refill. So the volume expanders, as the Ringer's lactate and the normal saline, will stabilize blood pressure and cardiac output. So to prevent what? Its progression to many organs failing. That's what they say, multi-organ failure. So early fluid resuscitation halts this cascade. Okay, so it also is a bridge toward definitive rehydration therapy. So after you give the anti-shock and the baby is stabilized, that's when you now go into the real rehydration therapy, where you basically give all those ORS, intravenous fluids and the rest of them. So I think that's it for this pediatric question. We'll quickly move to the next question here.